Welcome to the Global News podcast from the BBC. Hello, I'm Oliver Conway. And today we're joined by our health and science correspondent, James Gallager, to talk about the outbreak of Ebola in the Democratic Republic of Congo. And James, the World Health Organization has declared this a public health emergency of international concern. How serious is it?
Serious. It's definitely serious. There's more than 350 suspected cases, 90 plus deaths already. And we don't really know the true scale of the outbreak. It seems to be going on for several weeks before it's been detected. It's in multiple countries. So there's been cases in Uganda as well. So there's been cases that have crossed borders. And so it is something that has reached that point where it's going to take international coordinated effort to bring this outbreak to a halt.
And it's not the usual type of Ebola that we've seen. Tell us about this kind and how dangerous it is and how fast it can spread.
Yeah, so there are 6 different species of Ebola virus. 3 of them have been shown to cause outbreaks in the past. And this one, Bundibugyo, has only caused outbreaks twice before. It's not been seen for more than a decade. And that has been one of the slight complications here because say the blood tests for Ebola virus that would be available, they were all coming back negative because they look for the more recent species of Ebola, the ones we've had our experience with in recent outbreaks, not this one. So that has slowed the response down. And it also means we don't quite have the same array of tools for tackling the outbreak. So vaccination has become a really important way of tackling Ebola outbreaks, but there's no vaccine designed specifically for this species of Ebola, and there are also no drug treatments that specifically target this one either. So there's a few complications here.
Now, the original epicenter was at a mining town in Ituri in Congo, and an official there said people started to fall ill after an open funeral procession. Just remind us of how it spreads.
Yeah, so the main route of transmission as you go through the stages of the disease, you don't tend to spread Ebola before you have any symptoms. The first symptoms are things like flu, they're fluey. It's like a headache, a fever, fatigue. But then it goes into things like vomiting, diarrhea, your internal organs being affected. And then some people start internal and external bleeding as well. And all of those bodily fluids become a source of risk where the virus can be passed from one person to the other. And you can imagine as you go through those stages of infection, the disease progresses within inside your body, become more and more infectious through time. And that continues after you have died. So in those burial processes, like in those funeral procedures where, it's quite common that family members would bathe and wash the body as part of the funeral, you can imagine how that also becomes like a really serious moment in which the virus can spread.
And how worried should we be around the world about this?
I think in all honesty, that depends where in the world you live at the moment. So for large parts of the world, the risk is going to be incredibly minimal from this outbreak. Now, you can never say it's zero because that's just the nature of infectious diseases, but it will be tiny for most of the people on this planet. But that is not the case in the Democratic Republic of Congo and some of those neighbouring countries too around the region where this outbreak is taking place. So I would say that this is not the beginnings of a COVID pandemic, but we've gone beyond the point where this is something that can be very quickly and easily shut down without anybody else having to help out. And that's why it's been declared a public health emergency of international concern.
Now, we've recently had another health scare with hantavirus on that cruise ship. That doesn't have a vaccine. There's no vaccine for this type of Ebola. Will health experts around the world be trying to develop those, or is it just because it's not so common, you're not going to see the same sort of effort that we saw during COVID?
So when it comes to Ebola, there are vaccines for some species of Ebola. Now, there is a bit of a debate at the moment about whether they might still prove slightly effective here, because while they may protect against different species of Ebola, there might be something what's known as cross-protection, where they work not quite as effectively, but they work enough to still be worth using. That's still to be determined. And there are experimental vaccines that are going to be targeted at this specific species of Ebola too. But I think this is how the world is working at the moment. Many of the infectious diseases that would affect richer countries have had vaccines developed, and many of the infectious diseases that affect poorer countries have yet to have all the vaccines that they would ideally need. And that is That's just the statement of the world that we live in.
Yeah, and just remind us of the difficulties of dealing with an epidemic like this in a place like the Democratic Republic of Congo.
So one of your big issues here is just getting to people. So you need to be able to identify the people who are infected. And as I mentioned earlier, that the bog standard blood tests weren't picking up the fact that this was this particular species of Ebola. So you needed more sophisticated laboratory equipment in order to detect it. And that is something where you just don't have the same availability as you would have in a country like the United States or the United Kingdom or large parts of Western Europe. And so actually identifying the cases becomes part of the problem, and then you have to do contact tracing in an area that has conflict, that you have 250,000 people displaced from their homes in this area. So that's not like just going and knocking on someone's door and finding out that they're at that particular address. This is infinitely more complicated than that. And also, you have to imagine that you're in a setting where the biggest priority in people's lives might not be the fact that there's an Ebola outbreak. It might be getting access to clean water and food. And so you have to really be a part of the community and understand the community's concerns there. So it's not just a simple case of, we'll just go in and give these drugs to these people, we'll find them. It's actually a lot more subtle, nuanced and complicated.
Now, Congo has had more than a dozen outbreaks of Ebola over the past half century. Is this one different from those?
They're all different, and they all pose their own unique challenges. There are a couple of things that mark this one out as being more concerning. I'll be reassuring before I do the concerning bit, because it's clearly a country that's had a lot of experience with dealing and stopping Ebola outbreaks. So that experience is there. The things, though, that are concerning this time are, as we've mentioned, it's a different species of Ebola. So that changes the tools that we have in order to be able to stop this outbreak. There's also been this issue that it has clearly been spreading for some time. It's at least 3 weeks. And there's already quite a large number of people who've been infected in that period of time. And so when you don't have tools like a vaccine that you can go out and give to anybody who might have come into contact, you have to do quite old-fashioned detective work, basically, to stop an outbreak like this. And that means going out into communities, finding the people who have been infected, and then finding all the people that they have come into contact with. And that sounds really easy, doesn't it? As though that would be perfectly straightforward, but it really isn't, and particularly in the area that is affected here, because there's conflict in the area. There's a lot of migratory populations moving, not just around the area, but across borders into neighbouring countries. And so there are lots of things here that add to the complications of dealing with an outbreak that health officials are coming to quite late.
Now, you mentioned it had spread across borders. One person dead in Uganda, another case as well. Has it spread beyond that, or are those people who would have travelled from Congo, do we think?
That is the really important question that needs to be answered at the moment. So those people will have travelled from Congo, from one of the affected areas. That's where they'll have picked up the infection and then moved. The big question then is, after that has happened, have they passed that virus on to anybody else? And the incubation period for the virus, so that's the period between when you get infected and when you start showing symptoms, is between 2 days and 21 days. So that's quite a wide period of time. So we don't, in all honesty, actually know the answer to that yet. It's why many health officials are saying that we actually don't understand the true scale of the outbreak yet.
Now, there are some reports that a number of Americans have been exposed to the virus and that they may even be flown to a US base, a US military base in Germany. What kind of precautions would they need to keep people safe there?
Well, we've seen this before. So if we cast our minds back to the biggest outbreak of Ebola that we ever had, that was in West Africa in 2014 to 2016, nearly 30,000 people were infected during that outbreak. And that included many people from countries all around the world. Often it was actually healthcare workers that had gone in to help out and had caught the infection as part of it. And you saw many of them being medically evacuated. And the process is to put them into isolation units so there's no risk of them spreading the virus to other people, because healthcare settings, so things like Ebola clinics and hospitals, are major source of infection. If you think what I described right at the beginning, as the symptoms get worse, so does the risk of infection. By the time you're in hospital, those are the real moments at which there is a real risk of spreading Ebola. So the idea is lots of isolation, and then you'll have people treating you wearing a lot of personal protective equipment to minimize the risk of them catching the virus. The thing is, if they're going to a specialist military base or potentially even in the future to, let's say, a US hospital, that's a setting where you have all the resources in the world to throw at them, and you would expect the risk of the virus spreading in that setting to be really quite minimal. It's worlds apart from the situation on the ground in parts of DRC.
James, thank you. James Gallager, our health and science correspondent. If you want to hear more from the Global News podcast, click the link below. But thanks for watching.